This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
A program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest Gillian Jordan, who is the Public Health Program Manager for Infectious Diseases. And Gillian is here today to talk about what's going on with measles. Our topic is the current multi-jurisdictional measles outbreak, and to learn from certainly the Grey Bruce Public Health where we stand with measles and the measles outbreak. Gillian, thank you so much for being here today.
Thanks for having me.
So I also have questions because you were kind enough to develop them for me, which always is a help. So let's start. I know that there was a recent news release about schools, and because I know that's not first on your questions, but because it's hot topic, I'm wondering if you can speak to what are the steps that the public health is indicating should be taken when a measles case might be reported in the school?
Yeah, so locally to date, we've had about 47 as of today cases of measles. And so recently, one of those cases happened to be reported in an individual who attended a school in Grey Bruce. So for every case that is reported, the health unit does quite an intense case investigation, which was done for this individual to identify all the places that that person could have been while they were infectious, to identify who was exposed and to make them aware of that exposure and to provide them education and counseling based on whether or not they're protected from measles. So in the case of a school, we're looking at basically everyone in the building when a case is identified. So we know that measles is highly, highly infectious. If a person's in a room and then leaves the room, the measles virus can remain in the air for up to 2 hours afterwards. So when you think of all the people in and out of a school, it's hard to map over the course of a, say, 7-8 hour day where they were and where they weren't. So for this investigation, like I said, we identify everyone that was in the building that day as a potential contact and then go about our process as such. So that included for the students, looking at everyone who had been vaccinated and had maybe just one dose, which we're looking for people to have 2 doses to be considered up to date as far as students, and those who have 0 doses. For the people who are fully up to date with vaccines, so that's 2 documented doses of a measles containing vaccine. And for children, that might be MMR, which is measles, mumps, and rubella. But we also see MMRV, which basically adds varicella or the chickenpox into the vaccine. So 2 of those, there are really no conditions for them. And that would be the same in the community as well if someone were to be exposed. So 2 doses, we let them know to monitor for signs and symptoms. Just the measles vaccine is considered highly effective, but someone's always got to be that, I guess, 1% for the 21 days after that exposure, and they're free to go about their day. And that would be the same then for the teachers. If they have documented evidence of immunity, they're able to continue teaching, learning, attending school just as normal. On the flip side, where the focus of our investigation really is for those who don't have documented evidence of immunity. And the documentation piece, super key here. Fortunately for children, just because of how our school system is set up and the legal requirements for being vaccinated to attend school, there are very in-depth records at the health unit for all the kids that attend the school and how many doses of measles vaccine they do have. So we were very easily able to identify who had 1 dose and needed a second one, and able to get that second one and immediately return. Or for individuals who have 0 doses and would be needing to exclude for the 21 days after that exposure, just because of the risk that they're going to themselves develop that measles infection. So we were able to provide letters to all those students, letting them know kind of which category they fell into and those next steps, whether they're continuing to learn and monitor for signs and symptoms, or whether they have to stay home until they get caught up with their vaccines, or basically the whole 21 days they'll be out. Where it gets a bit more complicated is for adults. So though our records are really good for folks who are born from 1990 onwards, once you start going backwards a little bit more, it definitely becomes more challenging. So for adults born before 1970, we generally consider them naturally immune. There was so much measles circulating across the country at that time that we presume, even if there are no records for them for vaccine, as some people still do have that on file, that they're going to be safe and protected against the virus. But for those other people, we are looking for something on paper that says they've either had the infection and their body is showing protection from it, or documented doses. So for people, that might mean digging deep into their wallet and finding that little yellow card that many of us will have that have our documented immunizations, calling your childhood doctor to find which vaccines you have and haven't had. If you've lived outside the area, some people would have to call the health unit in which they grew up with to try and dig up those vaccines. But basically, it can be a lot more complicated for those born before 1990, which would include a lot of teachers. So similar to the students, we issue that direction. For those who are protected, you're good to go and carry on your regular duties. But for the other group, similar to the students, they needed to stay home until they could prove that they were protected.
Yeah.
So that's where we see, I think, some impacts in general school operations, is if you don't have enough people to run a school because they're still looking for those vaccine records. Yeah, there was some disruption in learning for one day.
Yeah. So I have a few questions about, just so I'm clear.
Yeah.
So someone who wasn't vaccinated,
Yes.
would have to wait 21 days or until such time as they had proof of being vaccinated.
Correct. Yes.
For the students who weren't vaccinated and if they had to be home, how do they continue with their learning? Like, is there a strategy that they don't lose too much from the learning process? That was my first question. I have another question, but if you wanted to answer that one first.
Yeah, for sure. So I'm not certain on what steps the school board would have taken to ensure that educational opportunities would have continued for those students. But I think the very promising thing coming out of this investigation was, so we started out with a list of, I think, 70 or so students who originally met the criteria for exclusion, so not being able to attend. The vast majority were children with one dose who were able to immediately get a second dose and return to school. So we know that one dose of vaccines, like 85 to 90% protective, but with a second dose, it's nearly 100%. So guidance says that as soon as you get that second dose, you're able to return. And many of these students only had one dose, not because they had chosen not to get the second dose. They were just in the younger years of their vaccine schedule. So it was just a timing issue. So as we've gone here, I think into week 2 of the investigation, the majority of folks are back at school and in their regular classes. So
yeah, so that's great.
Yes.
As far as infection control, like how do you? We've talked about the students, but do you provide direction to the custodial cleaning staff of schools on what to do if there has been an issue?
So fortunately, with measles, the cleaning IPAC practices that we put in place would be the same for most of our other kind of routine infections. Though we know it's extremely contagious, we also know that we have this incredible tool of vaccination to be able to control it. So rather than focus on masking or these other things that I think we put in place during the pandemic when there was a lot of uncertainty around how to stop that transmission. For measles, the answer is simple. 2 doses of vaccine, you're nearly 100% protected. So it would just be our regular things that we encourage at all times of the year. So our hand washing, wiping down common touch surfaces, which actually still in our like current month, we're seeing ongoing like influenza activity. This is the time of year when kids get rashes from other stuff. So not only is that important for measles, but just general day to day.
Thank you for that. It was really helpful for me to know the process and how it's addressed. So tell me where we are currently with measles and, statistically, what's the current situation?
Yeah, so as of last report, and reports are updated weekly at the provincial level, there were over 2,000 cases of measles reported so far this year. So that is in comparison to a dozen or so in the last decade. So this is a fairly major jump. And actually, I think this is the highest reported amount of cases that we experienced in Ontario as well as Canada since measles was deemed to be eliminated back in 1998.
Wow.
So we're seeing lots of activity here in Ontario, but also increased activity in Alberta or Saskatchewan. I think you've been hearing about also. But when we look at that locally, what that's meant for us is, 47 cases so far. And these cases actually are our first cases since 1996. So we've had a good run of time without any measles activity in Grey Bruce. And all of our cases that we've reported so far since it's 47 cases since October are related to this multi-jurisdictional outbreak that you mentioned that is very much concentrated in southwestern Ontario. And like the Ontario statistics, when we're looking at kind of how our cases have played out here locally, they've primarily impacted unimmunized individuals. Well, the vast majority are unimmunized individuals less than 19 years of age, so unvaccinated children.
So just to clarify, 2,000 cases in Ontario?
Yes.
47 cases in
Grey Bruce.
Wow.
Yeah.
Wow.
Yes.
And
when you look at some of the neighboring health units impacted most heavily from this outbreak very much have been Southwestern Public Health Unit, Huron-Perth Public Health, and they've been reporting hundreds and hundreds of cases. So I think Southwestern making up, I think at least half of those 2,000 or a quarter, those 2,000 cases that have been reported so far.
Wow.
Mm-hmm.
Wow. So of those cases, and you may have this answer. I know usually statistics are just right there. But of the 47, how many of those ended up in our hospitals?
So in Ontario, the number has been low. So fortunately for most people, especially younger children, they're able to recover at home with no real issues. However, since the beginning of this outbreak, I believe the number is, 140 cases associated with the outbreak have been hospitalized, 9 of which required ICU level of care. So fortunately, our local cases have fared quite well, but the illness can be quite serious, especially for infants, those who are very young, as well as actually adults older than 20. So where we talk about adverse consequences for older adults, it's not even the case this time. It's really people older than 20 and specifically those who have not been vaccinated.
I'm not sure if you can still see me. I can still see
Okay.
you. But as always, it's always a challenge when there
you're back. Yeah.
It's technology. So I apologize if I blanked out there for a minute. I really was focusing on what you were saying. So, it's interesting. As a parent, grandparent, whatever, we thought we got through this measles and, but this is a bit concerning, actually, I would think at this point in time, especially since it's been a while, 1996 since we've seen this. What does measles look like and why is measles a concern to public health?
Yeah, so interestingly, well, given that it's been such a long period with such little activity, what measles look like is something new for a lot of people, including physicians, younger physicians. If you weren't practicing maybe 1970s-ish time frame, there's a chance that never seen a true measles infection. So generally in an unvaccinated person who gets measles, from exposure, about 7 to 10 days afterwards, they'll start experiencing our general cold flu-like symptoms. So your fever, cough, runny nose, sore throat, sore eyes, and they'll carry on like that for a couple days until the kind of telltale rash develops. So for measles, it generally starts on the hairline or on the face, moves its way down the body, and the rash is a bit distinct given that it's flat and not itchy. So that can help us set it apart from many of the other childhood rashes that we see this time of year. So once that rash develops, the 4 days afterwards, as well as the 4 days before, that's when we generally consider people infectious and when we're asking them to isolate. And then the rash can stick around for some people for up to a week afterwards, even when they've been considered clear of their contagious period. For people who have been immunized, whether it's 1 dose or 2 doses, again, very well protected and unlikely to get measles infection. But if they do, it can sometimes present a lot differently in that it's milder than an infection would be for someone who gets it or is unvaccinated and gets it. And it's also generally going to be less infectious to others. So both those things are really great things about the vaccine. So not only this overall idea of prevention, but if you were to get it, just that lessen effects.
Often when we've talked about infectious diseases and viruses in the past, there are certain groups that are not only higher risk, but the impact on them is significant. I don't want to assume that I know. Can you fill me in on who you would be concerned about should they contract the virus?
Yeah, so again, the idea of unimmunized individuals being the focus of our investigation because they're at highest risk. But then in this, within that category, of course, we have infants. So not only are they high risk because they're unvaccinated, but often it's because they haven't had the opportunity or they're too young to receive that vaccine quite yet. Also, pregnant individuals. So if someone is unvaccinated and pregnant, it can create higher risk for them in their pregnancy, as well as there's risk to then passing that measles infection to the baby when it's born, and then starting back with, again, measles being high risk for those youngest children. For both unvaccinated and vaccinated people, there's another category that we are concerned with would be people with conditions that impact their immune system. So, of course, unimmunized, no protection, but we know some treatments, such as like cancer treatments or people who are on immunotherapy for other reasons, if they did start with protection from a vaccine, that treatment can knock down some of that protection. So sometimes they'll require additional care, even if they're starting with a history of vaccines.
Now, as a result of the measles outbreak, my understanding is the age for the first vaccination has changed somewhat. Can you tell us a little bit more about that?
Yeah, so there's a routine schedule of immunizations that is standard practice. However, certain health units, ourselves included, have been opened up to an expanded vaccine eligibility schedule. So this allows children to get doses sooner than they usually would to allow for protection earlier. So generally people are getting, or children are getting vaccines, I believe at 1, and then again, ideally before they're entering the school system. So this just allows families to essentially expedite that process. The quickest vaccine can be given is, I believe, 28 days apart. So usually they space it out over a couple of years. And previously that has been quite appropriate to have that kind of gap in between, just given the amount of measles or lack of measles circulating in the province. But now that we are seeing that present risk, yeah, it is beneficial to get as many people up and close to that 100% protection as possible in order to, prevent infection.
I'm delighted to say we're heading into summer.
Yes.
It's been a long, cold spring. But my question is, does summer make a change in people at risk and the chance of, how will this impact events and gatherings?
Right. Yeah. So first, we do, as far as measles circulation, know that it can circulate all the time, but in general, it does have a bit of seasonality to it. So very commonly a kind of winter into springtime infection. So the hope or expectation is throughout the summer, there's a chance that we'll see measles activity decline. So that's great, just to start. However, we have been getting lots of inquiries as a health unit about the different restrictions or protocols that places, summer camps, summer schools, events and gatherings need to be putting in place given the measles activity. And the great answer is there isn't really much of anything. Measles isn't COVID. And again, we have this extremely effective tool being vaccination to prevent infection in those with vaccine. And with high vaccine rates in our area, there's no real reason to make any adjustments aside from really pushing the importance of vaccine and getting those who aren't protected caught up with their immunization schedule. So as far as things that we're going to notice differently, nothing, which is great, especially after all those pandemic years. So
yeah, in other words, enjoy the summer.
Yes.
Participate in events and gatherings unless you're directed otherwise, certainly by public health. So there are groups of individuals who are not wanting to be vaccinated for various reasons. And can you talk a little bit about how you approach that situation, and also the advantage of what I used to think of, the term was herd immunity?
Yeah, for sure. We do know that vaccine hesitancy in general has always been something that public health has been working to address, but definitely a topic that has become more prevalent, relevant kind of throughout and post-pandemic times. So whether these are like philosophical, religious, kind of political stances on vaccine, our main goal is education. So we want to work with these people and communities to help address their thoughts and concerns around the vaccine, especially the measles vaccine is incredibly safe and, as I've said a bunch of times, very effective. So it's one that we think, is of huge importance given our current situation for folks to have. But we also recognize that fear can be a scary thing, and pushing it upon people that already have that fear, risks tarnishing important relationships that we need to maintain to promote and protect health in kind of other sectors. So really it's working with communities, educating individuals who are a bit apprehensive. And I think one of the promising things that has come out of this outbreak is, I think, real demonstration of the effectiveness of vaccine, as well as on the opposite end of things, the impact that measles can have on people, which might have been something that was lost after a couple decades of not seeing that infection much in children. So I think it's presented, some real-time learning opportunities, which we have very much seen sway certain people's decision who maybe previously weren't vaccinating to, start up with their immunization schedule. So that's been great.
Yes. So sometimes the awareness and just information, education, and support would prompt people maybe to reconsider.
Yes. Yeah, for sure.
I would imagine that it might be challenging for a parent if their child had to be at home when parents work. And, I would think that that could be quite disruptive as well. It affects more than just the individual who may have the virus, I would.
Yeah, for sure. Especially the after exposure, it's 21 days, which is the maximum incubation period. So that's the last date after exposure that you could potentially develop measles infection if you are at risk. And that is, 3 weeks is a long time to be kind of hunkering down and away from everything, waiting to see if you do get sick.
Yeah.
Mm-hmm.
Looking at the numbers, obviously the numbers are concerning.
Yeah.
What should we anticipate? Is there a cycle or a waning off point, or how soon can we be hopeful that there might be a change?
Yeah, and so an interesting thing about where we're at with the current outbreak and this idea of elimination status. So as I mentioned, in 1998, measles was considered eliminated, which is a designation that countries can receive after it's demonstrated that they're not having prolonged ongoing transmission. It's noted that a case or two here or there, it's going to happen from travel, but to have ongoing kind of spread within your country, is what they're looking at to be deemed eliminated. And it's usually demonstration of a year long that, so based on kind of the status of a year. So as a province and country, should we not be able to kind of get this under control, there's risk that status changes for us as kind of the rest of the world looks at how our measles activity is. I think the benefit of this outbreak has been increased uptake of vaccine and some of those measures to accelerate the vaccination schedule to get more people immunized. But we also know with natural infection comes lifelong immunity. So we're going to see some protection build that way as well. So we're hopeful that with the work that's going to continue throughout the summer, as well as going into the fall, back to school season, the traditional ongoing work that our vaccine preventable disease program does with student immunizations in schools, that if we kind of keep at this, we'll be able to get things back down to maybe how they were before this all got going.
Excellent. The work has to continue. Complacency around infectious diseases and viruses is obviously not good, but it can be understandable when you've gone so many years without something like a measles outbreak. But I have found this really, really informative. I just so appreciate all that you and the team are doing to try and protect our community. Thank you so very much for being on the program today. I really appreciate it. Hope you'll come back and fill us out. But hopefully it'll be good news like we're over it.
Yeah, I hope so too.
Thank you to our viewing audience for joining us today to hear more about programs, resources, and services available to you and to your family. This program has had Gillian Jordan from the Public Health in Grey Bruce talking about measles and our current situation. Take care and stay safe.
Connect with us by visiting our website or email us at comments@rogerstv.com.
You're watching an interesting local show on Rogers TV and you want to know more. That's when you head to rogerstv.com. Our website provides more information about our programs, our hosts, our schedule, and about how you too can get involved with Rogers TV. Visit us online at rogerstv.com.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers TV can